The Honourable Minister of Health.
Thank you very much, Mr. Speaker. It's my pleasure to rise. And I want to start, if I could, Mr. Speaker, by extending gratitude to the member for Vancouver Kingsway for his extraordinary work through this process. It was a long, hard discussion to find a place of meeting, but it's an example of what's possible when we in this chamber focus on getting things done, focus on working together rather than focusing on what divides us. I think sometimes we fundamentally misunderstand the purpose of democracy. The purpose of democracy is to build consensus. It's to find points of commonality and pull people together, to find common ground. It is not to find differences or sow division. Oh, I apologize. I thought there was something in my speech, Mr. Speaker, that had offended you in some way. But thank you. Give it time, indeed. Yes, I'm sure I can get there. Madam Speaker, it's a pleasure to see you in the chair. I also want to thank so many and some of them I'll reference, are phenomenal colleagues on our side who've dedicated in some cases decades to fighting for this moment, to fight for the moment when people aren't forced to make a choice between the medication that they need to stay healthy or the essential goods and services they need to stay alive, whether it be their rent or their food. You know, when we launched in the 1960s national Medicare, we forget how challenging that was. That was an incredibly turbulent period to actualize that and bring it to reality. The dream had long existed, but to bring it to bear was extraordinarily difficult. And at that moment in time, there were certain things left out, one of which was medicine. And partially because at that point in time, the number of medications that were available were very limited. They were typically prescribed in a hospital setting, and that they didn't have their use and ability and weren't as essential as they are today. But certainly that dynamic has changed. And this means, Madam Speaker, a new dawn for health. I would say that I'm going to talk specifically about Pharmacare and the legislation therein, but I want to, before I do that, just paint a broader picture of the circumstance that faced this. Like all countries everywhere in the world, the vast complexity of our health systems was overwhelming. And we are driving down a highway at 100 kilometers an hour, recognizing that we can't slow down and we have to change the engine while we're driving. And because of that difficulty, most health systems hadn't done the hard work of transformation and the really stepping back and looking upstream and how we deal with prevention and how we deal with reducing the amount of chronic disease and illness that exists within our system. And then the pandemic hit. And in the pandemic, everywhere in the world, the strains and cracks in our health system were laid bare. Healthcare workers were asked to carry a burden that was impossibly large, working night and day to try to keep their communities safe, carrying a load beyond imagining. But in that moment, here in Canada and in a few places elsewhere in the world, we saw something I think quite remarkable happening. And that was, in that chaos, there was one purpose in our system. What doctors and nurses and personal support care workers showed us is the possibility of what happens when we move with one purpose, with one direction, and we focus on people's health and nothing else. We set aside egos and jurisdiction and turf and make things happen. So in an incredibly brief period of time, Canada's pandemic response was indeed one of the best in the world, with one of the lowest death rates anywhere in the world. We had unbelievable support for the people that were working within the system and for one another for that period of time. And then challenges resumed. The pandemic began to recede. A war erupted in Europe. Global financial turmoil ensued. And we forgot the lessons of the fruits of cooperation and working together. And many of those divisions returned. And within our health system, we saw that there were a workforce who had carried far too much, who was dealing with burnout and yet still had the extraordinary weight of a system that needs to change. And you saw for the population that health was a bit of a hot plate, that people's experience of the pandemic, it was a trauma really for everybody. It was especially so for healthcare workers, but nobody was saved from the traumatic experience of going through the pandemic. But I would say, Madam Speaker, it's the responsibility not just of this government, but every government in this country to remember the incredible heroism of those who are working in the health workforce during those dark hours of the pandemic, to, with the same spirit of cooperation and determination, not focus on what divides us and what makes us different, but focus on what can be done. And that is no more important in any area than in health. I would say, Madam Speaker, that Canadians don't much care what political party you're from. They don't much care what jurisdiction it is. They want to see results. And that's why the $200 billion that we put forward to invest over the next 10 years in healthcare was so critical. Because it required an agreement with every single province and every single territory to develop a plan to deal with the crisis of today, to tackle those issues that are within our health system around workforce, around backlog, around health data, around sharing of patient information, and dealing with issues like administrative backlog and things that are legacies that don't make sense, to work with every province and territory regardless of their stripe. And I could say whether or not it's Adriana Lagrange in Alberta, or it's Adrian Dix in BC, or it's Michelle Thompson in Nova Scotia, or it's Bruce Fitch in New Brunswick, and you can go on, that in every instance, that spirit of cooperation pervaded our negotiations. That there was a profound understanding in those conversations that we have to be bigger than our partisanship and find commonality. And as a result, we have extraordinary agreements signed with all the provinces and territories in a short period of time to lay out the next number of years and what that health transformation looks like. That spirit of cooperation was also seen in Charlottetown, where in Charlottetown we were able to have an agreement on a couple of things that are really essential, Madam Speaker, on health data, on looking towards interoperability and how our systems work together with the digital charter, on reducing wait times for recognition of foreign credentials, taking it down to a 90-day service standard. We also were able to work later with the College of Physicians and Surgeons to take a process of credential recognition that's normally a couple of years and get that down to a couple of months. The other thing that these agreements did and these conversations that I think are critically important for the future of our health system is to establish common indicators, meaning that every province will have the same indicators for their health system, so that whether or not you're in Quebec and you're a Quebecer, or whether or not you're in Manitoba and you're a Manitoban, you can see how your health system is faring, not in anecdote, but in data, and you compare that against other provinces. Making sure that those indicators are there are essential, because it's so important that people feel that positive change and experience it in outcomes, but that it's also measurable in data. And in our federation, as we're making changes and interventions, that ability to have data and see how we're moving the needle is essential. What you measure, you achieve. And for the first time in these health agreements, we've set these essential tools of measurement to be a key component of our health system. Madam Speaker, we can then turn to dental care. And there are some who say, well, this is just a boutique intervention, something that's a one-off, but it's actually part of a broader vision of health. Imagine in this country there are 9 million people today who don't have access to dental care. And I want to thank my predecessor, Jean-Yves Duclos, for his extraordinary work. Sorry, yes, I know better than that. I want to thank the former Minister of Health and now the Minister of Procurement for his extraordinary work to get us to this point in dental care. I want to thank the NDP and the member from Vancouver Kingsway for their work, to work with our caucus and common purpose, to make sure that we pull over health, I want to thank parliamentary cooperation. And I would say to this place that this is what we were intended to do. That when we are elected as members of Parliament, we are not here to shout things at each other, to belittle each other, to put each other down. We're here to listen to each other. That the purpose of debate is to ensure that we take each other's ideas and that we find common ground. And in this bill, in Pharmacare and in dental care, we are embodying exactly what I believe our constituents elected us to do, which is to say that right now we have 1.8 million seniors. These are seniors in many cases who have never had access to oral health care in their life. I talked to a denturist that had a senior that hasn't had a new pair of dentures for 50 years. They lost their dentures, Madam Speaker, and they had no money to replace them. And the denturist saying that the dignity, the way that that senior felt, knowing that they were going to get new teeth in their mouth and that they could go out in the world and feel that somebody cared about them. The extraordinary nature of that. And when you go into seniors' homes and you talk to people working with seniors, and they say, is this really going to happen? And they talk about the dignity that comes. You know, it's not just about that healthy smile. It's not just about the fact that they're not going to wind up in an emergency room for an avoidable procedure. It's about the dignity of saying, we care about you. We see you. Your health matters. We have one of the most extraordinary healthcare systems in the world, but it cannot be the best healthcare system in the world unless oral health is part of the equation. Because when we don't take care of oral health, when we are not there for oral health, then the costs, not just in terms of social justice, but in terms of health outcomes, are entirely unacceptable. And I would submit that that's not the country we want to live in. I'm also extraordinarily proud, Madam Speaker, about 2 weeks ago, the Minister for Families, so many of us were there to launch the National Food Program. This is something when I was at Heart and Stroke I was advocating for fiercely, knowing that when a child goes to school hungry, it's impossible to learn. That when a child is denied nutrition, it has devastating effects on their health. And it's so sad to say that the research shows us just one healthy meal a day has a dramatic change on health outcomes for children. Just one healthy meal a day. And the other thing that it does is it gives kids a taste for what nutritious food is. They develop their palate. So for their whole life, nutrition and their nutritional profile has changed. That is an essential part of being upstream and avoiding illness and sickness. Dental care, a national food program, and yes, Madam Speaker, action on Pharmacare. Now, this is a big task. We know that some 21% of Canadians are struggling to be able to meet the financial burden of being able to afford their medicines. So we took essential actions on bulk purchasing, reducing the cost of medicine in this country by hundreds of millions of dollars by working with provinces and territories to do bulk purchasing. We're taking critical action in PEI with a plan for islanders on a pilot basis to improve affordable access to prescription drugs. And since June 1st of 2023, we've been able to reduce copays to $5 for almost 60% of medications regularly used by islanders. PEI residents have saved more than $2 million in out-of-pocket costs. So this was a precursor to show us what could happen. And when you go to PEI, and whether or not it's the member for Malpeque or who I know talks a lot about this or others, that when you hear the difference that that's making in the lives of people, to have medication taken off the table is a concern, it's absolutely huge. We also are launching we launched in March of 2023 a national strategy for drugs for rare diseases with an investment of $1.5 billion over 3 years. Because we know that, drugs for rare diseases can be cripplingly expensive and yet absolutely vital to keep people alive. And I think, I'll just give one quick story before I talk about the bill that's in front of us and the action that we're taking here. I had an opportunity on the weekend, a few weekends ago, to be away with my partner in the United States. And we watched somebody in front of us collapse. This person obviously was not a person of means. And as they came to, and I called 911, the thing that that person was worried about wasn't their health. It was how much money were they going to have to spend? How much money did me calling 911 burden that person with? Can you imagine that we don't want to be in a place with any element of health care where somebody who is of limited financial means, through no fault of their own, is in a circumstance where they can't afford their care. Where a nurse who's on the front lines of taking care of patients and investing their entire life in trying to make things better isn't given the opportunity to get proper health care themselves. So why these drugs? Why did we start with diabetes medication and with universal contraceptives? Let me start with diabetes medication, and I want to thank the fantastic advocacy for the member for Brampton South on diabetes specifically. There are 3.7 million Canadians, and it's growing, who have diabetes. When I had a conversation with 12-year-old Raina, she summed it up in Ottawa, I think, better than anybody else. She goes, as a 12-year-old, you know, it's really hard in this world. No 12-year-old should have to worry about all the problems of the world and also how they're going to afford their medication. And I think if 12-year-old Raina can get it, then this house can get it. When somebody doesn't have access to their diabetes medication, it means that they risk heart attack, stroke, kidney failure, blindness, amputation. I was talking to Sarah in a diabetes clinic who told me about patients who are reusing syringes because they can't afford them. The risk of blood-borne disease is terrible. That's not the country we should live in. So we all need to rise to this moment to say that medication as a precursor disease, when diabetes is so indicative of whether or not you have future chronic disease and illness, it's so essential that we make sure that we're there for them. On contraceptives, Madam Speaker, let me just give you one example that I think illustrates the case. Oral contraceptives cost $25 a month, and they have a 9% failure rate. The IUD costs about $500. It lasts 5 years, and its failure rate is 0.2%. So what it means is for somebody who doesn't have money, they end up choosing either the birth control option that is cheaper, that has a 9% fail rate, which means they're more likely to wind up with an unwanted pregnancy or with a sexually transmitted disease, if they're not able to make the choices that have autonomy over their own body and their reproductive health and future. And so it's absolutely essential, not only for health, because, for example, in British Columbia, they've demonstrated with UBC, they're saving more money with this initiative than it costs them to run it out. And that's similar, I think, to what we're going to see in diabetes. This has such a powerful effect in prevention that it actually reduced costs overall. But I think that the message it sends to women about their bodies and about their sexual and reproductive rights and autonomy is essential, which is in this country, no matter where you are as a woman, that you will get what you need to have control over your future and your body. That's a powerful statement, and it goes beyond just contraceptives as a drug. I can tell you that as a very young person, when I was very, very young, I was exposed to sexual violence. And I can tell you that that experience in a family that didn't talk about sex and didn't have a conversation about what healthy sexual relationships were had a devastating impact on my life, my self-esteem, and my ability to stand up for myself at different moments in my life. And I can tell you that for somebody who doesn't have the information about their sexual health, isn't told that sex would never have anything to do with violence, that violence is about control, that sex is about connection, that sex should always be consensual, that it should never be exploitive, that it should never involve violence, it should always involve what you want for your body, it should be pleasurable, and it should make you feel like you. And the fact that as a health minister, it's in any way controversial for me to be able to say those things, to be able to say to people, because whether or not you're in a marriage or you are intersecting for the first time with somebody sexually, understanding that it's okay to be you, that as long as it conforms to those things, that sex should be pleasurable and that you should feel empowered in your body and that you should have access to the reproductive medicines that you need to make choices about your life, it's going to save lives. Because I can tell you right now that the second leading cause of death for young people is suicide. We lose about 500 kids every single year. And way too often that has to do with them not feeling comfortable in their own bodies. And we have to end that. Madam Speaker, in totality, looking at all of these actions is a new dawn for health. Going up, dealing with the crisis of now, but looking at prevention so that we can build on what we started in the 1960s and ensure that all Canadians have access to the greatest healthcare system in the world. Thank you.
Questions and comments? The Honourable Member for Cumberland-Colchester.
Thank you very much, Madam Speaker, and interesting comments by the Minister of Health. Certainly he talked about the incredible results that he thinks he's getting with these new programs. Oddly enough, the backlogs for care in Canada have never been worse. 27 and a half weeks from time of seeing a primary care provider to getting treatment from a specialist, the worst in 30 years that they've ever been. His Canada Dental Care program, he wants to talk about how many people have signed up for it. And we know very clearly, and perhaps the question is really that the minister would like to ask, although we know he'll go on with his fantastical speech that he's had here in his incredibly fact-devoid fantasy. But that being said, the question would remain for his great dental care program is how many dentists have actually signed up for the program? And very specifically, Minister, if I could, through you, Chair, how many dentists in Atlantic Canada, specifically, Chair, how many in each provinces, Nova Scotia, New Brunswick, Newfoundland, and PEI have signed up for the dental care program?
The Honourable Minister of Health.
Well, Madam Speaker, it was true in the 1960s, and it's true now, that there are purveyors of doom. There are those who try to push people to despair, because when you don't believe in a public health care system, what do you want people to do? You want people to despair, because nothing comes from despair. All change comes from looking at what's hard and true and driving for change. So let's talk very specifically. Every healthcare system in the world is facing extraordinary backlogs as a result of COVID and stress on their systems. It's a question of how we meet that. And these 13 agreements and these investments of $200 billion are demonstrating that we are meeting that challenge. And in these plans, in articulated detail, is exactly how we're going to get to the health system that Canadians deserve. And with respect to dental care, we have thousands and thousands of dentists who signed up across the country, Madam Speaker. And secondly, just on Thursday, I met with the dental associations, and I can tell you that we're down to a couple of minor issues, and that I'm extraordinarily confident that over the next number of months, we will see virtually every dental office in the country participating in this program. And I know that the member opposite doesn't want that, but that's what's coming.
Questions et commentaires, l'honorable député de Montcalm.
The Honourable Member for Montcalm. Thank you, Madam Speaker. The Minister spoke about many things, but did not speak much about C-64. Now, when we raise Quebec's interests, he says that the Bloc Québécois is just looking to pick a fight. But we have had our own version of Pharmacare for a long time. But the minister did not sit down with Quebec to see how this bill will affect them and how they will work together. Does the minister know how many drugs are covered by Quebec's Pharmacare system? The health minister said that we have constitutional rights, but he says that we're looking to pick a fight. Are we looking to pick a constitutional fight then? We, the Bloc, seem to respect the Canadian Constitution more than he does, although his party did everything to ensure that we didn't sign in 1942. So how will this work with Quebec? The Honourable Health Minister. Thank you, Madam Speaker. When it comes to Quebecers, we want to help them as much as we will help all other Canadians. We want everyone in Canada to have access to a strong healthcare system that works for everyone. The same goes for Pharmacare. I had a great conversation, many conversations, in fact, with Minister Dubé, the Quebec minister. We are working together. Now, it's easy to pick a fight and raise problems, But the goal is to find solutions and ways to work together in order to fix the situation, to improve the health of Canadians. One example is indicators. For Quebecers and Canadians, that is essential. It is essential to be able to follow and track provinces' progress and to be able to compare and follow. It's also important to be able to follow federal money within the plan. That's why it's incredibly important to work together rather than to squabble.
Very much, Madam Speaker, and I'd like to congratulate the Minister for working attentively with the NDP effective opposition to actually bring about this historic debate today. This is going to make a difference on average, and I point to the Conservatives, to 18,000 of their constituents in each of the Conservative ridings across the country. Now, Madam Speaker, I wanted to reference one of my constituents in Burnaby, BC, resident Amber Mallott. She learned that she had diabetes when she fell into a coma just before her 21st birthday. With all of the types of insulin and injections that she takes, her monthly bill on insulin because of her diabetes is close to $900. Now, Madam Speaker, we saw last week the disgraceful exhibit of the Conservatives blocking even bringing this bill forward to the House. They blocked it from the kind of debate that we need to have on this bill. And Conservatives have indicated they would like to destroy this initiative. I wanted to ask my colleague, the Minister of Health, what would be the impact on people like Amber if the Conservatives had their way?
The Honourable Minister of Health.
Well, thank you very much, Madam Speaker, and I want to thank the Honourable House Leader, and now very pleased to work with him again as in his role as a critic for health, to say that he's absolutely right. First of all, that I appreciate that these were not always easy conversations, and they were indicative of the conversations when we were both House Leader, where finding that common ground as two different parties is often difficult. But I think that for people like Amber, you can see exactly what the difference is. And the cost and consequence for Amber of not being able to have access to the life-changing medication that Amber needs, let's be very direct, could be devastating. It could mean that Amber winds up with a heart attack or stroke. It could mean that Amber has a limb amputated or that Amber dies. It certainly means that Amber's less productive, less able to contribute to society, and certainly is going to have almost definitely an earlier death. So the cost of not providing that medication is far superseded by those negative outcomes, not just as a matter of social justice, but as a member of material cost. And I would say to the Conservatives, are they going to be there for Amber? Are they going to be there for people who need their diabetes medication? Are they going to vote for their constituents who need these medication, or are they going to vote against it?
The Honourable Member for Don Valley East.
Thank you very much, Madam Speaker, and I want to thank the Minister for his speech. I'm proud to be part of a government that is bringing forward new national programs like childcare, student nutrition, dental plan, and of course, Pharmacare. It's been decades since a government in this country has moved forward with such massive programs. In fact, we haven't seen this type of movement for many, many decades. So I'd like to ask the Minister, the relationship with the provinces and territories, as you move forward, what has been the response by some of the key people, ministers and other stakeholders in other provinces for this specific plan?
The Honourable Member to speak through me, please. The Honourable Minister of Health.
Thank you, Madam Speaker, and I thank the member and my friend for an important question. I think that I've been so encouraged by the conversations that I'm having with every provincial health minister across the country, regardless of their stripe, whether or not I'm talking to Everett Hindley in Saskatchewan or I'm talking to Zoma in Manitoba, that the conversations have been incredibly productive and positive, focused on how do we get people the care that they need. And I think, I would really challenge the Conservative opposition. Instead of talking about how they want to destroy dental and how they don't want Pharmacare there and how they're going to block a national food program and tell people the reason they can't, don't dream. You can't have it. Don't dream that you could get medication. Don't dream that you could have dental care. we're going to make sure that it doesn't work. We're going to call dentists and scare them. We're going to give them false information. We're going to work against people getting care, and that for political reasons. And I think that we should listen very carefully to what they say. Are they asking questions about how they can help? About how they can ensure that people get dental care? Are they asking questions about what are the problems that dentists have? And how can we help fix them? Because we want to make sure people get dental care. No, Madam Speaker. They're saying give up, have despair, they can't do it, and shame on them for it.
Resuming debate, the honourable member for Cumberland Colchester.